Living a healthy lifestyle can help reduce your risk of colorectal cancer, but regular screening is also important. Testing can often find colon cancer early when it's most treatable, or sometimes even prevent it altogether.
There are things people can do to reduce their risk of colon cancer. Exercise, avoiding fat, eating more fruits and vegetables, while quitting smoking and cutting back on alcohol. But there's one risk factor that we can't control: age.
90% of colon cancers are diagnosed after age 50. The risk starts rising around age 35 and reaches the peak at age 80 when it's approximately 400% higher than in your early 30s.
Dr. Jankoff at the Baptist Family Cancer Center says that's why screening for colon cancer is so important. But people may hesitate, finding the test for blood in the stool or prepping for a colonoscopy uncomfortable. Occasionally, the problem affects people outside the usual age group. Ron Kirksey, who used to work in the airline industry, was diagnosed with serious colon cancer in his 40s. He spoke to us via Skype from his home in Arkansas.
The first actual cancer diagnosis that was given to me as stage 4. That's what I was told, that I had stage 4, which is the final stage, of course, of cancer. And I have always been a fighter. And I looked at Dr. Donovan at the time. I said, well, how are we going to fix this?
At the time when we found his colon cancer in large bowel, he also had evidence of a lesion or metastatic spread to the liver and to one of the adrenal glands.
Surgery to remove the cancer cost Kirksey 30% of his bladder and 3.5 feet of colon. There had been chemo before the surgery to shrink the tumors and more after to kill any remaining cancer cells.
After all this surgery was done, I met with Dr. Jankoff, and he was my oncologist, gave me 6 weeks to recover from the surgery, and then we started the chemo.
Complicating things was the fact that at the time of his cancer diagnosis, Kirksey had been dealing with another debilitating disease for nearly a decade: multiple sclerosis.
Actually, it was one more thing. I had already made peace with the fact that I had a debilitating disease in the MS. I've always been active. I played athletics, played sports all the way up and into college. And when I had my first experience with the MS, I was actually umpiring a high school baseball game.
Kirksey has been recovering on a family farm in Hickory Ridge, Arkansas. He's planning to move to Memphis for a seasonal job with the Memphis Redbirds. Because of his age when diagnosed, his son will have to begin screening for colon cancer even earlier. But while his is a success story, Dr. Jankoff says it's the kind of success doctors want to avoid, mostly by getting people to have timely screenings.
Nobody should ever die of colon cancer, in my view, because we have such an effective secondary prevention measures, such as colonoscopy, which is very accurate. In more than 90% of cases, will detect a polyp, which is how we want to find the colon cancer.
For Smart Medicine, I'm Doug Johnson.